How to solve case studies questions in NCLEX RN exam. 20 points that you should know with examples. In the Next Generation NCLEX, each candidate is presented with 3 scored case studies, each consisting of 6 questions for a total of 18 case study questions. These questions are a pivotal component of the exam as they evaluate your clinical judgment and ability to apply nursing knowledge in real-world situations. It is for this reason in this video, I will be showing you with example 20 strategies and key points you should have in mind while solving any case studies question. Let's see a case study about diabetes mellitus management. In this tab of nurse's notes given here, the patient, Mr. Mark Smith, a 55-year-old male, presents with increased thirst, frequent urination, fatigue, and a non-healing wound on his left foot for the past 3 weeks. On assessment, he is alert but fatigued. His skin is dry, and he has a 3 centimeters by 2 centimeters ulcer on the bottom of his left foot with mild redness but no drainage. His capillary refill time is 3 seconds, and his breath has a fruity odor. His blood sugar is elevated at 320 milligram per deciliter, and he reports irregular insulin use due to cost concerns. In the next tab, you will see that the patient has a medical history of type 2 diabetes, which was diagnosed 10 years ago, hypertension, and hyperlipidemia. He has no surgical history. His medications include insulin glargine as irregular usage, metformin, lisinopril, and atorvastatin. He has a social history of smoking, occasional alcohol use, and a sedentary lifestyle. There are no known allergies, and his family history includes type 2 diabetes in his father and hypertension in his mother. These are the vital signs given, so what can you understand about these vital signs? Let's see the blood pressure first. The elevated blood pressure of 145 systolic and 92 as diastolic readings indicates hypertension. This may be contributing to his overall health issues, especially considering his history of hypertension. Heart rate and respiratory rate. Both are within normal ranges, 88 beats per and 22 breaths per minute, suggesting no immediate concerns with his cardiovascular or respiratory function. Oxygen saturation. A saturation of 97% on room air is within normal limits, indicating adequate oxygenation. Weight and BMI. With a basal metabolic index of 31.6, Mr. Smith is obese, which can increase the risk for complications related to his diabetes and hypertension, including cardiovascular problems. The next tab shows different diagnostic results. The lab results indicate poorly controlled diabetes, high blood glucose and A1C, potential kidney dysfunction, elevated creatinine and BUN, an increased cardiovascular risk, high LDL, triglycerides, low HDL. The elevated CRP suggests inflammation, possibly due to the non-healing foot wound. Immediate management is needed. So, overall, what did we observe about this case? Let's make a summary. Mr. Mark Smith, a 55-year-old male with a 10-year history of type 2 diabetes, presents with poorly controlled blood glucose levels, symptoms of hyperglycemia, increased thirst, frequent urination, fatigue, and a non-healing foot ulcer. His medical history includes hypertension and hyperlipidemia, and he has been non-compliant with his insulin regimen due to cost concerns. His vital signs indicate mild hypertension and obesity, and lab results show significant dyslipidemia and renal function impairment. Imaging studies rule out osteomyelitis in the foot, but soft tissue swelling is present. Urinalysis confirms hyperglycemia, but no ketosis is noted. The patient's current condition requires prompt intervention, including better management of diabetes, addressing the non-healing wound, and improving medication adherence. Let's now learn 20 points on handling the case study questions. Introduction of case studies. The Next Generation NCLEX introduces case studies to better assess a candidate's ability to make clinical judgments and think critically. Unlike traditional exams that focus on recalling information, these case studies simulate real-world situations that nurses face in their practice. For example, you may encounter a multiple response question asking you to identify findings in a patient with diabetes that suggest complications. The question might provide a scenario where the patient has an A1C of 9.5%, blood glucose of 310 milligram per deciliter, fruity breath odor, and a non-healing wound. You would need to analyze the data, recognize which signs indicate potential issues, and make decisions about the next steps in care, mimicking real clinical decisions. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. Decision-making. Point number 2. 3 case studies. Each NCLEX exam includes at least 3 scored case studies, each containing 6 related questions, making up a total of 18 questions. Here in this particular example, there are 6 questions: multiple response, drag and drop, drop down, highlight, matrix or grid, and multiple choice questions. This particular case study is related to diabetes and management, but overall case studies may cover different clinical scenarios, ensuring a comprehensive evaluation of a nurse's ability to manage a variety of patient conditions. For instance, one case may involve a pediatric patient with respiratory distress, while another focuses on an elderly patient with heart failure. Point number 3. Unfolding scenarios. Case studies in the NGN exam follow an unfolding format, where patient information is gradually revealed in stages. This method reflects how nurses receive patient data in real clinical settings, requiring them to adjust their clinical judgments as new information emerges. For example, in a multiple response question, you might first receive basic details about a diabetic patient, such as a blood glucose reading of 300 milligrams /Dale and a non-healing wound. As the scenario progresses, you may learn that the patient has increased thirst and urination, and that their wound is showing signs of infection. These new data points would change the clinical picture, requiring you to reassess your priorities and select the correct nursing actions based on the updated information. This unfolding format mirrors real-world nursing practice, where information is often revealed over time and decisions must adapt to evolving conditions. Point number 4. Clinical Judgment Measurement Model. Questions in the case studies are based on the NCSBN Clinical Judgment Measurement Model, which guides nurses through the steps of recognizing and analyzing clinical cues, prioritizing hypotheses, generating solutions, and taking action. For example, in a multiple-choice question about a patient with a high blood glucose, fever, and a draining wound, candidates are asked to identify the priority nursing hypothesis. This requires the nurse to analyze the clinical cues such as the elevated blood glucose and signs of infection and prioritize the most urgent issue, which in this case is risk for infection related to a non-healing wound. The question tests the nurse's ability to make an informed decision based on the data presented, reflecting the process of clinical judgment in real-world scenarios. Point number 5. Multiple question types. The NGN case studies incorporate various question types, such as multiple response, drag and drop, drop down, highlight, and matrix or grid questions. These formats test different aspects of clinical reasoning and decision-making. Point number 6. Realistic scenarios. The scenarios presented in case studies are designed to mimic real-life nursing situations, ensuring that the exam evaluates practical skills. For example, in a drag and drop question, a nurse may be presented with a patient who has poorly controlled diabetes and a non-healing wound. The nurse is asked to prioritize the appropriate interventions for the patient. This question mimics real-life decision-making, where the nurse must manage the patient's blood glucose levels, address wound care, and consider infection control, all while coordinating with the healthcare team to ensure the patient's overall well-being. Point number 7, layered information. Case studies present information in layers, including nurses' notes, medical history, vital signs, and diagnostic results, requiring candidates to analyze data from various sources. For example, in a multiple response question about a diabetic patient with a fever and a draining wound, you may first receive the nurse's note mentioning the patient's elevated temperature of 101 degree Fahrenheit, followed by lab results indicating given blood glucose level and a high white blood cell count. The patient's history reveals they have a history of poor glycemic control. To answer the question, candidates need to consider all these cues, fever, elevated blood sugar, and infection signs, to identify which findings are most concerning and require immediate action. Point number 8, critical thinking. The NGN case studies demand higher-level critical thinking skills compared to traditional multiple-choice questions. Candidates must analyze complex situations, interpret data, and make well-reasoned decisions. Point number 9, partial credit scoring. Unlike traditional exams, NGN case studies use partial credit scoring, allowing candidates to earn points for partially correct answers. This system recognizes nuanced understanding. For example, if you correctly identify 2 out of 3 necessary interventions, you may still earn partial credit. Point 10, pathophysiology focus. A deeper understanding of pathophysiology is essential for analyzing case studies effectively, as it helps candidates connect clinical signs to the underlying disease processes. For example, in a multiple response question that asks you to identify the risk factors for complications in a patient with poorly controlled diabetes, recognizing how high blood glucose levels and infections, such as in a non-healing wound, can lead to diabetic ketoacidosis is critical. Understanding that DKA can cause electrolyte imbalances and alter blood faith will guide your decisions about the priority interventions, such as administering insulin to control blood glucose and addressing the potential infection to prevent further complications. Point 11, identify and analyze cues. Candidates must identify relevant cues in the patient data and analyze their significance to determine appropriate actions. For example, consider a case study where recognizing decreased urine output and elevated creatinine in a patient can help you identify acute kidney injury and decide on interventions. Point 12, prioritize hypotheses. In NGN case studies, candidates must prioritize hypotheses based on the urgency and risk of the patient's condition. For example, in a patient with multiple injuries, you might prioritize airway management over other less critical issues like pain management. Point 13, generate solutions. Generating solutions involves identifying expected outcomes and planning interventions to address the patient's needs. For instance, for a patient with pneumonia, you might plan for oxygen therapy, antibiotics, and respiratory support to achieve the desired outcomes of improved oxygenation and reduced infection. Point 14, take action. This step focuses on implementing the highest priority interventions based on the patient's condition. For example, administering epinephrine to a patient in anaphylaxis takes precedence over other less urgent tasks, reflecting real-world decision-making. Point 15, evaluate outcomes. After taking action, candidates must evaluate whether the interventions achieve the desired outcomes. For example, after administering insulin to a diabetic patient, you would monitor their blood sugar levels to ensure they return to the target range. Point 16, comprehensive preparation. Familiarizing yourself with the NCLEX-specific case study format is critical for success. Preparation should include understanding the test structure and practicing with similar scenarios. For instance, reviewing mock case studies about chronic conditions like hypertension can improve your readiness for the exam. Point number 17, mock case studies. Practicing with mock case studies provides valuable experience in applying critical thinking to realistic scenarios. For example, working through a simulated case about myocardial infarction can help you refine your ability to assess and act on patient data efficiently. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. 18. Deeper understanding. Surface-level memorization is insufficient for NGN success. Candidates need a deep understanding of the material. For instance, knowing stroke symptoms is not enough. You must understand the underlying causes and implications to prioritize interventions effectively. Point 19. Connecting the dots. NGN case studies test your ability to connect various aspects of a patient's condition, such as lab results, symptoms, and medical history. For example, recognizing that a patient's hyperkalemia is linked to their kidney disease helps guide appropriate treatment decisions. 20. Real-world application. The ultimate goal of NGN case studies is to reflect real-world nursing practice. They ensure that candidates are prepared to handle complex situations in clinical settings. For instance, managing a patient with acute chest pain during the exam mirrors the quick, accurate decision-making required in an emergency room.